Joining us for a little bit this morning is State Representative Cedric Glover. Hey, Mr. Cedric, how are you today? Merry Christmas,
morning,
by
Robert.
the way.
Good morning, Aaron. How
Morning.
you guys doing?
Good.
Big story. Ochsner to take over. I'm not even sure if that's the right word to use. There is a pending deal. Is there a pending deal between Ochsner and biomedical research that everybody's going to sign off on? What's the latest? What can you tell us?
Well, there's certainly an effort to bring in Ochsner to partner with BRF and to have them ultimately take over management and operations of University Health. If you guys will remember, this is an effort that was initially started over 2.5 years ago that would have sought to have Shreveport partner up with the #1 hospital system in the state of Louisiana and one of the very best in the country to bring to us in this area the kind of medical healthcare competition that we need in order to be able to lower prices, increase quality, and give a better opportunity for our doctors to be able to train and hopefully stay here in this area or in Louisiana and continue to provide high-quality health care to our citizens.
So let's start with point number one. How is Ochsner's involvement going to lower medical costs?
Well, right now we have a healthcare monopoly in Northwest Louisiana. We have one provider that has 77% of this market. Our costs are higher than anywhere else in the state of Louisiana, and our quality is lower. So when you have a monopoly, you have higher costs and lower quality. And I think we've seen some developments here in the last couple of months since October that have revealed the extent to which folks involved at that monopoly at Willis-Knighton have gone to try and maintain that market dominance. That's understandable from their perspective because it results in more money, more control, and more ability to be able to manipulate prices within this market. What it does not do is serve the interests of those who are patients who are seeking health care in this region, nor does it serve the interests of those who are healthcare professionals who want to be able to have a healthy, dynamic, competitive market in order to be able to ply their trade, whether they're doctors or nurses or clinicians in some other fashion. You don't want to ever end up in a one-horse, one gas station, one-store town. Consequently, we also don't want to ever end up in a one-hospital town either.
Pardon me just a second. You had said a couple of seconds ago that there is a problem in this market in Shreveport-Bossier with the quality of health care. Specifically, I would assume you mean University Health. Are you throwing a little dart here at biomedical research? That's not a...
No, not at all. As I mentioned, we have one provider in this market right now that has 77% market share. When you have 77% market share, it means that you essentially have a monopoly. Anytime you have a monopoly, your quality goes down, your costs go up, and everyone except you suffers. And so because we don't have the kind of dynamic competition within this market, we end up in many instances, as you probably have seen some folks relate to you about their various experiences at some of the hospitals in this area that they don't think is in line with what an area the size of Shreveport actually deserves. And so what I believe needs to happen is that we need to have added competition to this market. We do not need to allow additional acquisition of market share so that we can have the kind of competition that serves the best interests first and foremost of patients seeking health care, but that overall gives us a more competitive environment in terms of cost for the services provided, as well as providing doctors, nurses, clinicians, other folks who are in the medical healthcare area, the ability to be able to have an option as to where it is that they choose to work and where they want to ultimately end up building a career.
How are we going to get a deal done by the end of the year?
Well, I don't know if there's a possibility of being able to get a deal done by the end of the year. I know that there's the intent of getting a letter of intent done by the end of the year. And understand that this is something that was attempted in the spring of 2015. You guys covered it. The Shreveport Times covered it. Others did as well. And it's also detailed within the details of the antitrust suit that involves Willis-Knighton and BRF and Vantage Healthcare, how there were very specific, deliberate efforts to undermine any effort to bring competition to this market. And there were very specious reasons given publicly. But as has been discovered in terms of what happened behind the scenes, you had doctors who had Willis-Knighton affiliations that also worked with the medical school who were told you can go to that Ochsner meeting, you just can't come back here and work with us. And so when you end up with that sort of manipulation, with that sort of self-serving aggression, then it ends up being impossible within a political environment to try and forge the kind of partnership that would serve this area. He ended up with, I think, some affiliations that ended up developing between Ochsner's and Christus and what have you, but nothing of the substance that was envisioned. Thankfully, in the 2 years plus since that time, there has been a coming together of various forces, and to his credit, Governor Edwards, who has stepped forward and offered leadership in this regard, in many instances, counter to, I think, the wishes of his own staff, and that Jay Darton has not served this effort very well. And I think Robert Adler on the governor's staff has helped to undermine some aspects of this as well. We now have, I think, a set of circumstances where we're looking out for the best interests of the people of Shreveport and Northwest Louisiana, and not trying to figure out how it is that we facilitate market expansion on behalf of Willis Knighton.
You have made on numerous occasions the point, you've talked about the discrepancy, the financial discrepancies, the funding discrepancies between Shreveport's hospitals in the southern part of the state. Like we get, what was your number, 32 or 36 cents on the dollar. How is Ochsner's involvement going to solve what previously we've talked about is such a major problem?
Well, that's a problem that has to be solved no matter who's the operator. And the truth of the matter is, had we had fair funding for the Shreveport Medical School and the Shreveport Hospital from the very beginning, we may not ever be talking about having to bring in an outside partner, because the ability for BRF to effectively function would not have been challenged or questioned. I think all of those things were deliberate, in my estimation, in an effort to try and bring about the failure and the downfall of BRF as the operator, as you've seen detail within some of the discovery from the antitrust lawsuit. So, yes, one of the messages that we're also simultaneously sending to the governor and to our colleagues in Baton Rouge and New Orleans is that we need fairness in funding for Shreveport and its operations. But then not only that, we need a fair agreement. Remember, one of the most egregious provisions of the MOU for BRF in terms of operating the Shreveport Hospital is that they were never able to get LSU Medical School to provide them fair market pricing for the physician services that they were paying for. What they were told is, we're going to send you an invoice. You pay the invoice no matter what's on it. If you challenge whether or not this is actually fair market value for the services that we're charging you for, then we'll go to arbitration to resolve that. That's one of the best ways to kill the cash flow of any operation, is giving me a bill that you don't have to justify, demanding that I pay for it, and then putting me in a position to where if it is unfair, I get arbitrated on the back end.
You're going to have an uphill fight, though, getting more money. Those lawmakers in Baton Rouge and New Orleans, you're going to be taking money from the New Orleans hospital, and they're not going to go along with that really easily. Are you worried about that?
Well, now, Aaron, and then those poor little legislators are going to have to do what? We're going to have to put on our big boy britches and go down to Baton Rouge and fight for Shreveport, and fight for Bossier, and fight for Northwest Louisiana.
But there's not enough of you. I mean, you're outnumbered, right?
Well, but at least we've got to start it, don't we?
You bet.
We can't sit back and simply accept the fact that New Orleans is worth twice the money that Shreveport gets for providing the same exact service. We've got to at least start by acknowledging that there's a problem. We've got to at least be willing to not continue to operate the way we have, but acknowledge that there are challenges and that there is an unlevel playing field that Shreveport is operating under in so many different ways, and begin to be willing to go down and fight for it.
Do I need to get some big boy britches for some of the local lawmakers for Christmas?
Now, I'm going to leave that up to you. But now, mine are obviously pretty large.
Does having Ochsner potentially in your corner, in our corner, Ochsner's got some pretty big britches?
Yes, they do. Ochsner's is obviously one of the premier healthcare systems in this country. If you look at how well they are rated, how well they're regarded, and the record they have over the decades, we should consider it a great opportunity for us to be able to partner with a system with that type of wherewithal. Now, here is where one of the great opportunities exists, and that is for us to be able to expand our research mission here, because that's one of the areas that Ochsner does not have a great deal of experience or capacity in. So having the ability to be able to create some real synergy by taking all of the gravitas that they bring as a hospital system, combine that with a medical school and a teaching hospital and a research component, and we have the potential to be able to see these assets here go forward and really fulfill the vision that so many of us have had for them over the years. And that is not just being a great place to get a medical education or to receive health care, but also an opportunity to be able to grow the wealth and opportunity for Northwest Louisiana.
I was just going to say, you've said forever that you think the future of Shreveport financially, economically, is as a medical research center. You obviously think that Ochsner being involved with our hospital and possibly the medical school will point us in that direction.
Well, and Robert, that's not just something I believe. That was the very basis of the founding of the Biomedical Research Foundation way back in the 80s, when we had that all bust as I was coming out of high school. And we said to ourselves, guys, we got to get all of our eggs out of this single economic basket. Let's look around and see what assets we have that we can capitalize on. We discovered at that time that we're one of 140 or so communities across the country that are homes to academic medical centers, a medical school, a teaching hospital, and a research component. BRF stepped up and added that research component. And if you look at other communities around the country, whether you're talking Birmingham with UAB, or Baltimore with Johns Hopkins, or Minnesota with Mayo, or the Texas Health Center in Houston, and even Little Rock and Mobile and Memphis and other places, these assets have come together to not only create a substantial number of jobs, but to create a substantial number of new businesses and new wealth based upon the activity attendant to them. We've never managed to be able to maximize that potential here, in my estimation, for a whole lot of reasons. What I'm saying is that as we go forward, we should see this as one of our greatest assets, one of our greatest opportunities, and be willing to go to Baton Rouge, Washington, D.C., and anywhere else to fight for it.